the next topic. Shall we straight dive in the next topic or take a break?
Maybe can continue this topic, Doctor.
Hmm. All right. Aging process. My favorite topic. All right. Let's go. Next slide, please. Okay. Objective of aging process. Understand what is aging in human. All right. This is objectives. Differentiate type of aging process. There are three types of aging process you must remember. Know all factors that affect aging. There are five types of factors that affect aging. Some factors we can control, some factors we can't. All right, we'll go through in a while. Able to explain why certain people age faster. Very useful information. We can always deliver this to our clients. Why certain people age faster and certain people they age, but in a slow mode. Develop conceptual ideas on how to delay aging process. Yes, everybody will definitely ask you all this question. How are we supposed to delay aging? Yes, we can delay aging, but it has to be started in a early stage. Not only after 50 years or after 60 years, so muka semua berkedut baru nak think macam mana delay aging is too late. Okay, but in aesthetics, nothing is too late. You always can do things to look better, of course. All right, and compare skin changes in various age groups. All right, we're going to compare the skin changes in various age groups: young, middle age, and old people. Okay, next slide, please. All right, these are the aging process. Okay, aging process is a process. Aging is a process of becoming older. It's a process that is genetically determined but environmentally modulated. Meaning is you will eventually age. Aging is unstoppable, is imminent, is definite, but it can be affected by the environment, sunlight, pollution, the food we eat. All right, the type of atmosphere being exposed to can change or affect your aging. All people age, but not at the same rate. Aging is not a disease. So don't go to a doctor asking for medicine to stop aging. No, aging is not a disease. Aging is a process. Everybody have to go through aging, but the good news is you can delay aging. Next slide. Next slide, please. Right, aging. These are process of aging. Aging does not only involve your skin. It involves your skin, involves your fat layer, involves your muscle, and also it involves your bones. So all these four factors, all these four structures are involved in the aging process. You can see the depletion. Picture number one, changes in skin and fat. All right, when the fat layer, we have 9 fat layers on each side of our face. Here 9, here 9, so 18 fat pads. So as we age, these fat pads deplete, or we call it atrophy. It reduces in size. When it reduces in size, our skin becomes sagged. And that's what contributes to skin sagging. So when the skin sags, then your wrinkles, which happens to be your fine wrinkles, becomes more prominent. So skin fat atrophy contributes to aging. Okay, skin and fat. And the third picture and the fourth picture explains how your muscle and your bones are involved in the process of aging. Same, the muscle loses its volume, the muscle becomes atrophy, becomes thinner, and becomes less dense. And when it does that, your aging process becomes very obvious. At the same time, when we age, our bone becomes thinner as well. Okay, previously a very dense bone. When we age, unfortunately, it becomes less dense and becomes brittle and becomes thinner. So all these four structures are involved in your aging. So when we age, you do not only focus on your skin, the skin is outer layer. The other structures which maintains the integrity of your outer layer skin are the fat pads, muscles, and your bones. So in order for you to maintain a healthy aging process, you must involve all these four structures. All right, next please. Okay, these are the aging theories, right? Aging theories. So, a random mutation of somatic cell DNA, so introduction of abnormalities. So, our DNA or cells are mutating constantly. So, that mutation will cause aging. Other related theories would be increased cross-linkage collagen with other proteins. So collagen, when it reacts with other proteins, it will lose its integrity and apparently will cause us to have skin sagging as well as wrinkles. And free radical tissue damage. Free radical tissue damage is contributed by the sun's ray. Okay, sunshine. Any rays, any light from the sun can cause our skin to have a process called oxidation, and this oxidation will cause us to have an accelerated accelerated range of aging. All right, next please. Okay, so as I told you, there's about three types of factors which causes aging. Actually four, but we'll be discussing only about three. One is chronological aging. Chronological aging is aging in your years. So as you age every year, this year 39, next year you're going to be 40. That is we call chronological, meaning aging, which is a natural process. Okay, you can't stop this. So when you age in a chronological aging, what will happen is you'll have a natural loss of collagen due to lack of production. When we age, our hormones get depleted and our collagen production will be less. So lesser collagen production and with the weakening of elastin fibers will cause our skin to sag. So that is chronological aging which can't stop. Every year you will continuously age. All right, next. The second one would be hormonal, of course. Hormonal will relate to menopause, will relate to andropause, will relate to pregnancy, will relate to some diseases which can alter your hormones. Hormonal aging is results of the body natural evolutionary process. So as you said, when you're pregnant, when you're menopause, you have estrogen reduction, and this reduction will eventually bring you to have a accelerated aging process. So as you can see that when you are very fertile, you will not age that much. But once you are menopause, the aging process increases. Signs of the hormonal aging process would be medium or deep wrinkles, loss of collagen, slowed cell regeneration, increased oil production, blemishes, and dryness of skin. All these are common problems you face when you have a hormonal aging. All right, next. The next would be the thing that we can control, which is photoaging. Accelerated by environmental factors, stress, pollution, sun damage, and radiation. All these four you can control. So the type of aging that we can control is photoaging, aging which is caused by light, aging yang disebabkan oleh cahaya. All right, light from matahari, light from the sun, light from your indoor bulbs, light from your mobile or your electronical devices, light from your PC, from your tabs, from your handphone. All these lights contribute to photoaging. Proses penuaan yang disebabkan oleh cahaya. Study shows that 80% of premature aging caused by environment. Premature aging means aging that is premature, which is you're not supposed to age in that such. But unfortunately, you're aging. So even though you're 20, you look like 30. But that is called premature aging. Okay. Excessive solar exposure leads to increased production of free radicals. I told you, oxidation. All right. This free radicals will speed up the oxidation process, and unfortunately, will speed up your aging process as well. The signs would be dark spots, pigmentation, jeragat, uneven texture and tone, fine lines, wrinkles, and hyperpigmentation. Okay, hyperpigmentation and dark spots like jeragat. All these are caused by sunlight. So, photoaging, the only aging factor which you can control. And there's another aging factor, we call it glycation. Glycation means yang disebabkan oleh pemakanan. So, all food which contains high amount of sugar is known to be a factor to accelerate aging. All right, so remember, starchy and sugary food can accelerate your aging process. All right, that you can control your food and you can control your exposure to the sun. These two factors you can control so that you age gracefully, not prematurely. All right, next slide. Okay, these are two diagrams or pictures which denotes the how the younger skin and the older skin looks like, and we differentiate it. All right, you can see the three skin layers. I'm very sure that the doctor would have discussed with you yesterday about the layers of the skin. These are the three main layers of the skin, and you can see the dermis layer is the most, not to say most, one of them. It's an important layer which affects your aging. Okay, it contains elastin, collagen, oxytocin, and fibroblasts. Okay, so when we age, this dermis layer, which contains elastin and collagen, unfortunately will deplete. When it depletes, the outer layer, which is the epidermal layer, will lose its integrity and will form deep or fine wrinkles. So the collagen and the elastin in dermis determines the wrinkles in your epidermis. So don't only focus on outer layer of your skin to maintain your age, to maintain your young looking appearance. Always remember that one of the important structure, all are in your dermis layer. So you should always consider dermis layer which has collagen and elastin in order for you to maintain a proper anti-aging treatment. Okay, next slide, please. All right, let's go to signs of aging. Okay, next slide. These are the signs of aging. Yeah, sunspots. Very, very common sign of aging is sunspot. Skin aging is going to happen, but lifestyle environmental factors can make you appear older than you are. For example, you know the sun can harm your skin, but this damage can actually age your skin's appearance with unsightly brown patches. As we enter our 30s, we begin to see the cumulative impact of sun damage, including sunspots. So sunspot is caused 100% by sun damage. So what we usually advocate is to always wear your sunscreen whenever you go out. Always wear sunscreen and a moisturizer whenever you go out. Sunscreen, the use is to protect you from the sun rays so that you do not get sunspots, you do not get hyperpigmentation, and you do not get lentitions. Moisturizer, why are we advocating, is it will maintain the integrity of your collagen and your elastin. It will make sure your skin is supple so that the epidermis layer is not compromised. Okay, so these two facial products is very, very important. Moisturizer and sunscreen. These two you have to wear every day in order for you to properly engage in a way to, not to say anti-aging, you can delay your aging. All right, next slide. Brown spots. Yeah, brown spots, infrared and high energy visible light from your phone can also leave its mark on your face. So brown spots can be caused also by your telephone, your PC, your tabs, and whatsoever. Every electronic gadgets that you use can cause you to have brown spots and hyperpigmentation. certain wavelength of visible light, especially blue light, which is emitted from your computers, televisions, tablets, smartphones, and even your indoor light bulbs. Indoor light bulbs on top of you can contribute to spots. So, what we take home message here is to not only wear sunscreen when you're going out, when you're indoors as well, you should remember to wear your sunscreen twice per day. The, the actual method of wearing a sunscreen would be early in the morning when you go out on your stay in. You wear your sunscreen, and after 4 hours, approximately during lunchtime, after taking lunch, wash your face and reapply your sunscreen. Okay, sunscreen should be always applied twice in a day. Okay, it's not to be applied once in the morning and it will last until evening. No, it will lose its efficacy. And a proper or appropriate SPF to be used, would advise can use SPF 50 and above. SPF 30 should be okay, or 50, not more than that. All right, next slide, please. Okay, wrinkles. Two types of wrinkles. One is a dynamic wrinkle, another one is a permanent wrinkle. Dynamic wrinkles is a wrinkle which happens when you move your face, when you smile, when you frown, when you cry, when you laugh. Whenever you do that, if you see the fine lines appearing, that's called fine wrinkles. Permanent wrinkles, dynamic wrinkles. Permanent wrinkles is wrinkles that are permanently there, like your nasolabial fold, your under eyes, your crow's feet. Some people have mental labial, your marionette line, and so on. Okay, so wrinkles are these fine lines around your eyes, maybe the first sign that your skin is starting to age early. The dermis is the layer that is responsible for keeping your skin tight, firm, and free of fine lines. Remember that dermis is the layer, not epidermis. As we age, cell renewal begins to slow. The skin's outermost stratum corneum thickens and elastin fibers in the dermis fall into disarray. Okay, when the elastin fibers and the collagen in dermis falls into disarray or dismantles itself, depletes, fortunately, the epidermis will lose its integrity. Okay, the skin outermost stratum corneum thickens when you age. And that's why when you see old people, their skins are very thick and velvety. Because the skin renewal, all right, doesn't take place when you're old. Right, boost your collagen, which fills in these lines and gives skin more plumpness, with products containing ingredients like peptides, growth factors, stem cells. All right, you should always consume, or you should always wear topical products which consist of collagen, which consist of peptides, and which consist of stem cells, so that all these factors will go and have an effect on your epidermal layer. And I told you to reduce wrinkles, you must maintain the integrity of your epidermal layer. So do not just wear products which are only friendly to your epidermis layer. The dermal layer plays a very important role. So whatever you use products, it should consist of all these ingredients so that you can maintain the integrity of your epidermis as well. All right, next.
Dr. Varan, there is a question
Slide,
from Dr. Yuli.
Yes, please. What the
Miss
question
Yuli?
would be?
Excuse me. What you meant when you say growth factors? Which ingredients I can identify?
Okay, growth. Right. Okay, growth factors. Usually, when you have your skin products, you must make sure that it has a little layer of retinoid. Retinoid is a growth factor. It's a vitamin, skin vitamin. So it's a derivative of vitamin A. What it does is it increases your new skin production. That is what we meant as growth factor. And niacinamide. Niacinamide is vitamin B. So you must make sure your product has a certain or a decent amount of retinoids and also niacinamide. Both these are growth factors. Other than that, you can also have ground substance like hyaluronic acid. Hyaluronic acid will maintain the integrity of your skin or your epidermis so that it is plump and it is always moist. When moisture is secured, your skin renewal will take place automatically. Hmm? So I hope that answers your question. The retinoid and niacinamide
Thank you.
and hyaluronic acid, of course. Yep, you're most welcome. All right, should we go to the next slide? All right, this picture shows wrinkles. So you can see from the top, you call that frown lines. When you frown, when you're angry, when you do this, do that, all have wrinkles. But that wrinkles is not permanent. So it is called dynamic wrinkles. Okay, it's your under eyes, your crow's feet. So these types of all these are types of wrinkles that consist of dynamic wrinkles and permanent wrinkles, right? So, right, next slide, please. Okay, what we can see here, these are the regions. These are the regions of concern which can deplete or can cause us to look or appear more aged. So all these layers or all these regions are connected to the fat layer. Remember the fat layer that I've told previously? 9 fat layer here, 9 fat layer here. When the fat layer depletes, all these regions would be appearing sunken. So in order for us to maintain this region's suppleness, what we can do is you must use a product with growth factor. But if the sunkage has happened, the only thing we can correct the depletion of these areas would be by applying fillers, by injecting fillers, okay, to fill the space that has been lost. Okay, all right, next please. I think we're coming towards the end of our session here regarding aging process. If you feel like you've begun to take a hollow appearance, it might be because you're losing fat below your skin. You see, sagging is losing fat below your skin. So fat is not bad after all. This layer of fat supports and cushions the skin, giving us our plump, youthful contour. However, as we mature, we lose volume in this age. It's imminent, meaning it will happen apparently. So we must really make sure that we do not lose fat as much as like it takes. So even though if we lose fat, we must replace the fat that has been lost with certain types of products, with better products. All right. Okay, next slide, please. Okay, I told you these are the changes. When you age 45, you can see the fat layers is like depleting a bit. When you age 35, when you age 45, it's depleting further. And when you age at 55, you can hardly see any fat layers available. So, yep, when you're 55 years old, when the changes happen, the only thing you can do is by injecting fillers. So, in order for you to reduce aging, in order for you to make sure you do not age as fast, you must always protect your skin. All right, protect your skin and make sure the skin is always hydrated. Drink a lot of water, apply moisturizer. Sunscreen is very important. Take a lot of vegetables and fruits. All right, vegetables and fruits would be the main part of your meal to take care of your skin. And take vitamin C. Take vitamin C every day. Vitamin C is considered as an antioxidant. It will reduce the process of aging. You can take green tea. You can take any vitamins which has A, C, E, all green and leafy vegetables, colorful fruits. All this will help you to age gracefully and then will help you with your natural aging process. All right, next slide, please. Yeah, the same picture, the same concept, a different picture. All right. Next slide, please. Okay, a very normal V shape, inverted V shape. One, the inverted V shape has happened. What we can do is you can't do much though. We can do it really needs a procedure to be done, minimally invasive procedure or plastic surgery once the inverted V is there. So before you go to inverted V, you should take care of your V shape. All right, proper regime, proper skin care, proper skin routine will help you. All right. Okay. Next slide, please. All right. This is what will happen. Okay. Once your skin has sagged, the other thing you can do is to do a face lifting. Face lifting, what you can do is you can have a particular surgery done under a plastic surgeon to lift your face, right? To lift your sagging skins up. That's what we can do. All right. How are we supposed to delay aging? Yeah, this is one of the things that I told earlier. So how you can delay aging is protect skin from excessive sun exposure, sunscreen. Apply self-tanner moisturizer. Stop smoking. If you're a smoker, stop smoking. Nicotine increases your aging rate. Eat healthy and well-balanced diet. Less alcohol, of course. Drink 1 to 2 liters water per day. You can drink more. There's no restriction of 1 to 2 liters only. You can drink more water as much as possible and exercise, of course. All right, next slide, please. Okay, so these are a type of the materials or the skin food or skin vitamins that you can apply or you can consume in order for you to maintain a very good an appropriate skin care regime. Antibiotic peptides. Antibiotic peptides. It destroys the pathogen present and acts as a protective barrier to the skin. If you have any skin diseases outside, like acne or whatsoever, you can have an antibiotic to be applied on that particular spot. Okay, natural elastins. Natural elastins will be found in your skincare products. Glycolic acid. Glycolic acid is a chemical which peels off your outer layer of dead skin. So it's a natural exfoliate. If you go for skin peeling, if you go for chemical peeling, the most common acid they use is glycolic acid. Okay, glycolic acid is an acid extracted from sugarcane to exfoliate the outer layer of your skin. The epidermis layer, the stratum corneum, which consists of all dead skin. So dead skin is exfoliated. You encourage the the natural skin renewal. Okay. And number 4 would be natural collagen, prevents your skin from sagging. Of course, collagen. Collagen, usually, I don't advocate collagen, drinking collagen whatsoever. I don't have any studies saying that it's efficient, but collagen in your skincare product. Vitamin A, C, and E. Yes, it's a skin vitamin. It's A, C, and E. All these 3 are antioxidants, very, very important for your skin. Natural solar filtrate sunscreen, of course. And natural allantoin helps to repair and reduce the scar tissue. So this allantoin is a substance which you can find in certain skincare products which can to reduce the scar, to reduce the scarring, and eventually to reduce the hyperpigmentation. All right, so that you have an even skin. All right, next slide, please. Oh, thank you, slide. All right, thank you so much. I hope you understand the skin aging, and it's a very important topic. Every client walks in your practice will ask you, what is the way, what are the ways I can advocate or I can continue, I can do to delay aging. So all that slide is very, very important for you to get your advice for your clients on how can they reduce the aging or how can they delay the aging. There's no such thing as anti-aging. Aging is imminent. Aging will eventually happen, but you can always reduce or delay aging. That's the art of aesthetics. You must be able to explain to your clients, you must be able to teach your clients on how are you supposed to delay aging. Okay, everybody's concerned about aging. Okay, none in the world that they think that, okay, so right, let me age. No, no one will ever think that. Everybody will find any possible way to reduce aging or to stop aging. Okay, so I hope that slides was very informative for you to advise your clients and always teach them. Okay, don't just ask your clients to come and then you do your procedure and then they pay you and they go back. No, always teach your clients, always educate your clients. When you educate your clients know your capability. It increases your credibility. They have confidence in you and they have an idea how are they supposed to take care of your skin. Okay, offer something that none other offers them. Education. Teach them. All right. Thank you so much.